Hey, welcome to Adapting Class. I don't know what you know, how you approach your prioritization questions. I know there's so many techniques, but you have to be sharp. You have to be sharp means you're being clinical. When you're clinical, you worry about something that will kill the patient. You have just 1 second. What do you want to do? This is the question, first question, right? And what does BESHARP mean? So it starts with the BESHARP, where you take care of a breathing problem. If the patient has a breathing problem, it's a priority. If he has electrolyte issues like potassium, magnesium, calcium, you have to worry about, and sodium. The S is sepsis. You can have sepsis, or you can be in shock. The H is their temperature is low. Hypothermia is worse than temperature of 103. Don't worry about it. Worry about somebody temperature 96 than somebody temperature 103. Okay. And A is just the airway. You know, there's a bunch of buzzwords. When you know, they won't tell you it's airway. They will tell you it's Triad, restlessness. All those things are a problem. And the R is neurological problem, consciousness changes and other thing. And P, when I deal with P, I'm talking about life, limb, eyesight. That's all. You can't have pain anyway. If it doesn't involve your eyes, something that you're going to lose your life and limb, I don't care about you. So let's take a look at it. How do you do prioritization? Just break the thing into two. Look at what is being asked and what is the situation. This guy, he has pneumonia, sepsis, BESHARP. But what is the problem? The sepsis is not enough. He has antibiotic that is due. Okay, we got to make sure we give them the antibiotics so that they can have amount of antibiotic in the system, the concentration enough to be able to cure the sepsis. So this guy, you got to hold on to that. Let's see if there's something there. COPD, what is your problem? You have 89 SATs, the last shift. Throughout the last shift, you've been 89 and you're still alive. Should I care about 89? COPD patient, their SAT is never 100. If you see COPD patient SAT 199, something is wrong. They live in 89 to like 93. So just leave this patient alone. Let him enjoy himself. So just leave them alone. Client with asthma, right? And shortness of breath after albuterol. Look at it. You have asthma. Okay, fine. I give you albuterol, right? The beta agonist, you should be fine. You shouldn't be having shortness of breath. That means albuterol is not working and you're having breathing problem. Your breathing tube is not helping you. That's a BESHARP moment. So this guy, you also have to hold on to that. This guy has abdominal cramps. What do we do for her? Him or her? Dicyclomine. This is what? Anticholinergic. Anticholinergic, what is the side effect? You slow down your gut. And when you slow down your gut, you're going to have crampy pain. Should you worry about this? This is what you expect this patient to do. You're going to have a crampy pain. Just deal with it. In terms of your exams, you say it to your head, but you got to be therapeutic. But for this case, this is what I expect the patient to behave. The pain is not the issue. This pain is not going to kill them. They're not going to lose their life and they're not going to lose their limb. So you got to have something to focus on. That's BESHARP. You are being sharp by selecting somebody who does not have time. And the person who does not have time is the asthma patient. Why do you want to choose the pneumonia patient? It's sepsis. We have some time with them. Fine, we give them the antibiotic. But this guy continues to have shortness of breath, he loses airway. So A and C are very troublesome, but when you sharp, you pick number C. That's how you do prioritization. Adapting class. and you see what BESHARP look like. It's a versatile tool that will make you make any diagnosis, prioritization. It makes it so easy that you can talk through it, like you dealing with the rare patient, not a diagram, no time. We don't deal with time or anything like that. Clinical way of looking at the patient. Okay. One down. Just 8 questions, then we'll be done. A client presents to the emergency room after blunt force trauma to the right eye. Which of the following is a priority? Sometimes you're just dealing with one patient, but you got to apply the same strategy. I have to be sharp. You keep on telling yourself, the guy busted his right eye. What would you provide for this patient? This is his eyes. He has 2 eyes. This is right eye, left. This is busted. Any trauma to the eye, there's only one thing you worry about: increase intraocular pressure. That is your number one. As soon as the patient presents, because if there's too much pressure, the bleeding will cause pressure, and the pressure will cause injury to the damage to the nerve. So you have to deal with the pressure as your priority. They can have pain, but I need to worry about pressure. So you have to be sharp. So you see, I don't look at the question. I do my content, and I come up with what I expect. This is what I think the answer should be. It should be something to decrease intraocular pressure. Spend 2 to 3 or 2 to 5 seconds. When you do that, the answer choice, you don't even going to guess. I know I'm looking for something that will what? Decrease intraocular pressure. Right. So that's what I'm going to do. Okay. So you give them imipramine. You have to recognize this. This is a TCA, right? It has anticholinergic effect. Somebody with intraocular pressure, you give them anticholinergic, you're making that worse. So this is gone. Well, I got to irrigate your eye, but does that affect my intraocular pressure? No, you're wasting time. Being sharp. That is what prioritization is. You're going to check visual acuity. He busted his eyes. He or she busted his eye. Yeah, I mean, you expect him to see. What are you going to gain from it? Increase intraocular pressure needs to be dealt with. So put his head up, and he will be happy. That's how you do prioritization. Once again, Adapt NCLEX is the place to go to check, do prioritization. Number 3. These are always a trappy question. Don't look at the numbers. Don't let the numbers trap you. Look at the situation and make a diagnosis and figure it out. That's all. Like I told you, don't look at the numbers. Look at the situation, break it into 2. What is this? Diverticulitis. I see anheides. Whenever you see anheides, expect fever. Anheides, expect what? Pain. Anheides, expect what? Why can't you be high? It can be 1 million. I don't care. Okay? These 3 is fine. So if you have IDs, you have temperature 102, yeah, enjoy. You have anheides and you have Murphy sign. This is a name we give to right upper quadrant pain. So the Murphy sign is the same thing as what? Pain. Well, I expect you that. You have appendicitis and itis. Your white count is 20,000 because you have anheides. Test taking strategy. If I've eliminated 1, 2, and 3, I got to pick 4. Even if I don't know what it is, I got to pick it. So I got to pick it. So I got to pick it up. So pancreatitis and small umbilical bruising, this patient is bleeding. So that's a problem. It's a problem for them. This patient is bleeding, is having hemorrhage, and you have to be sharp. Pancreatitis and your total lung capacity has changed, you're having airway issue. But if you have IDs, symptoms, it's fine. So don't worry about it. Next question, a bunch of words. Try to break it down. Try to break it down and figure it out. 4 patients, right? 4 patients. If you have 1 second and you have to be sharp, who will you choose? Do you choose me or somebody else? Choose somebody that is not going to get sick. You have 1 minute or 1 second. Who is a priority? Break it down. 55. Okay, I got you. AFib, atrial fibrillation, fine. What is the problem? Heart rate of 60. What did I do to you? I give you a beta blocker. It's a blocker. It's going to block your heart rate and it's going to control your rate. We have a rate control AFib. You got to clap. Hey, yes, we did a good job. And we got to go on. Don't worry about it. It's 60. It's fine. Did I tell you it's dizzy? Did I tell you his blood pressure is going down? Did I tell you the patient is diaphoretic? Don't bring anything into the answer choice. Stick with what they've given you. AFib, at rate of 60, and you have, after I give you metoprolol, yes, that's what he's got. But if I see he's diaphoretic, he's dizzy, yeah, you have to worry. You got to be sharp. You can't leave that one go away. So 1 is down. The kid is 8 months old. He's young, so you only have few diagnoses, you can figure it out. The severe, right? Audible, congestion is a trap. Don't follow it. What is happening? He's coughing. His nose is running like pipe and he has mucus. Can you figure out what is the problem? 8 months old, a bunch of congestion and he's coughing and running nose. If you pick this, you are not being sharp and you don't know what is the problem. This is bronchiolitis in a kid due to RSV. You have to know this for your board. They trap you all the time. They always come in, congestion, excessive running nose. This is RSV infection, bronchiolitis in the kid. Don't worry. There's no retraction of the chest. I've not told you the chest is retracting or anything like that. So, or they having respiratory symptoms. All they have is congestion and a running nose. So we ignore it. Now, 35, okay, young guy, you have chest tube for what? Pneumothorax. Okay, chest tube for pneumothorax, and you have small intermittent bubbling of in the water seal chamber. The water seal is what prevents air from escaping into the chest. If you have pneumothorax, I expect you to have some bubbling. I don't want to see a bubbling in the water seal chamber, but if I see it, it has to be small, it has to be intermittent, and it's not continuous. And you have pneumothorax, I expect some small bubbling. Therefore, this is gone. If you don't know, you have to pick number 4 because, yeah, you already eliminated 1 to 3. So don't go back and pick something that is not right. So this is gone, this is gone, this is gone. So your answer choice is this. If you have mononucleosis, your spleen get bigger. This is kissing disease. And the spleen and the liver, they get bigger and bigger and bigger because they can sequestrate blood. If I punch you in the belly, you're going to rupture them. Because of that, we don't want you to do any contact sports. No contact sports for 14 days, not 13 and a half, exactly for 2 weeks, which is 7 days. If you go play basketball, you're going to bleed to death. So number 4 is your right answer. You see what I'm doing? You have to bring your content. So if you don't know it, check out that thinkers. But this require you. That's what prioritization. Nobody can teach you prioritize. It can give you strategy, but you have to bring your knowledge base. Like something that you have to know what mononecrosis is. What should I worry about mononecrosis? And then you use it to answer a prioritization question. No contact sports for 14 days. If you're playing soccer or basketball, we have problem, a BESHARP moment. So I got to intervene. Okay. I don't know. The same token. The nurse has become aware of 4 clients. Which client situation require immediate intervention? Which of this? Okay. You have to be sharp once again. Who require immediate intervention? Which one of this? I have a diabetic patient, hemoglobin A1C of 8. This is a 3-month problem. I have 1 second. Why would it's 1 second in 3 months? That's a bunch of seconds. I don't have time for you. 1 second in 3 months problem. Well, just deal with that. We'll deal with it later on. And I just have 1 second. So let me go and see if I can give the 1 second to somebody else. Irritable bowel syndrome. And I give you dicyclomine. It's an anticholinergic. That's the treatment for that, to slow things down, right? Anticholinergic, what does they do? Dry mouth, urinary retention, right? Dry eyes, constipation. You have dry mouth, expected side effect. I will educate you about it. Okay? Trigeminal neuralgia, where you have pain in one of your face or whichever due to injury to the cranial nerve 5, right? And then you're on carbamazepine and your temperature is 100. Contents, you got to bring it here. Carbamazepine, it causes pancytopenia, which will decrease your white count, and therefore you develop agranulocytosis. You see, it look like clozapine. Clozapine also do the same thing. So carbamazepine causes pancytopenia and lead to agranulocytosis. Any drop of fever, any cough, any runny nose, you got to run to the hospital. Otherwise, you're going to be septic. So this problem, we have sepsis here, BESHARP moment. Sepsis, BESHARP. Diabetic, right? I give you metoclopramide and you have diarrhea. Then you tell yourself, diabetic, their gut, GI tract slows down, okay? And so we give them something to speed it up. Metoclopramide is used to speed it up. It helps with the motility of the gut. If I improve your motility, you're going to poop a bunch of diarrhea. You're going to have diarrhea. So this is an expected finding, and it's not that bad compared to somebody who have sepsis. So this is your friend. That's your friend. So number 3 is your right answer. And that's the way you approach it. There's no magic. You have to like bring some content and know how to tackle them. Look at them. Don't use those times, hours. No, this is all you have. Don't bring anything in. and see if this is an unexpected finding. And if it is, you just let it go. Prioritization 101. The same thing, 4 patients. 4 patients. Which of these patients you want to see? Which one is more dangerous? If I give you 30 seconds, it's too much. I'm giving you 1 second. 1 second to fix this patient. You have 1 second. Finds with concussion. Okay, from what? TBI. Your GCS is not normal, 14, and you have headache. I'm worried about you, right? Let's see if there's somebody here. This guy has a neuro issue. It's a neurological problem, right? You have Bell palsy, and you have facial droop on the left side. That's what I expect. You have neurogenic shock. Neurogenic shock. Look at the word. Sometimes prioritization is definition. They just take the word and rewrite it and see if you understand it. Neurogenic shock. What do I expect in neurogenic shock? No sympathetic tone. Therefore, your parasympathetic take over. What will happen? Your heart rate goes down. Your blood pressure goes down. Because you lose your sympathetic tone, your veins become bigger. You increase the capacitance of your vein. You see what it's not memorization. This is just content and a clinical thinking. If your vein get bigger, think about it. I want you guys to think about the concept. You don't memorize it. The vein get bigger and it cannot squeeze. So you hold a lot of blood. If you hold a lot of blood, your skin is going to get flushed, red. Your face all get red. Your face will be red. This is what I expect. Bradycardic, hypotensive, and flush. This is normal. It's not a problem. You have head injury. Your heart rate is going down. Your blood pressure is going up. And you have irregular breathing, chain stroke breathing. You figure out what this is? This is AB normal. When you see this bradycardic, hypertensive, there's no way you should be hypertensive and brady. And then you have irregular breathing. This patient brain is herniating. This is the Cushing phenomenon. He's dying. You got to fix him. So that's your patient. It's more dangerous than the normal one. These 2 are expected, but 1 and this have a problem, but 4 is more dangerous. So you got to pick number 4. You have 1 second. So pick number 4 and fix 4 before you go to number 2. Pharmacology. Mental health pharmacology. I know it's always people run away from it, but just sit back, be able to recognize the medication, and then you can figure out what is going on. So this is a selector apply. There may be more than 1 answer choice. And nurse has become aware of what? 5 clients. Which client situation require intervention? Same story, break it down. See what is the problem and what is associated with it. And I'm going to break 1 by 1 and we can eliminate them just using our knowledge. You got to bring your knowledge and help me. I'm on fluvoxamine for depression. You have to recognize this. And you're taking what? Tramadol for back pain. Does that sound right to you? Does that sound right to you? You got to bring your knowledge. You got to recognize that medication. There's nothing that you can run away from this question. These kind of questions, they ask you pharmacology, you can't prioritization, you can't run it. You got to know something about the medication. And the way to remember, I put them in the group. This is an SSRI. That's all. That's all I care about. And this is for pain medication, tramadol. Unfortunately, tramadol, it acts on serotonin. So I'm taking something that is going to increase my serotonin in the system, and you're taking something that will activate serotonin. We have a problem, serotonin syndrome. This patient has serotonin syndrome. We got to see him. You don't have to pick everything, select or apply. Nowadays, the strategy is, if you don't know it, leave it. Pick those that you know you're confident, and that will, you save yourself point. If you don't know it, that number one, tramadol, yeah, what? Activates serotonin, and therefore, when you combine with an SSRI, will lead to serotonin syndrome. Just let it be. Just don't pick it. Don't guess. You don't need, you don't get to get anything by guessing. Lithium for bipolar. I told you what it's used for. I've told you what all of them is used for. So you don't have to figure out what is it. You have to just bring back what kind of class of medication or their side effect. And you're taking bupropion for smoking cessation. Right. Then you ask yourself, bipolar patient is on lithium. This is acceptable. Bupropion is also acceptable for smoking cessation. But what is the problem? Bupropion, what does it do? It makes you high, hyper. It makes you hyper. What does the bipolar patient look like? An hyper patient. You want them to they're going to go into mania. So they're on lithium, but if you put it on bupropion, they go into mania. So don't do that. This patient, you got to see him. Fluoxetine, right? For depression, I told you what it is. So it's an SSRI, right? And patient has history of anorexia nervosa. You ask yourself, what is anorexia nervosa? Their BMI is low. It's less than 18.5, severe one. It's very low. They're underweight. If you give them SSRI, you're doing them good. What is the side effect of SSRI? Weight gain. So you don't even have to worry about it. They will gain weight they don't want. So the treatment for eating disorder, put them on SSRI. They're going to eat. Even if they don't eat, they're going to gain weight. So weight gain is good. So this patient is doing good. We don't need to intervene. So that one is fine. So that's number 3. Nortriptyline for depression. And you have ondansetron for nausea. Are you connecting them? Nortriptyline is a TCA. It causes QT prolongation. If you don't know the side effect of them, it's called dance. Every time you see TCA, think about the dance. They will do the dance. They have dermatitis issue, anticholinergic, neuro problem, cardiac toxicity, and the E means evaluate for those dance. Anybody who is on TCA, check for the dance, whether they have skin rash, that's side effect, they have anticholinergic side effect, they have dizziness, they have cardiac toxicity, and one of them is prolonged QT. What is the side effect? If you want detail, check my YouTube site, you'll be fine. Down syndrome for nausea. What is the side effect? QT prolongation. You want to combine QT prolongation together? No way, we can't do that. So that one too, we have a problem. And the last one, fluoxetine for depression. I've told you what it's used for. No, paracetin, sorry. It's used for depression. What is that? SSRI. And I give you this, sumatriptan for migraine. Bring it on. This, it does the same thing as tramadol. It stimulates serotonin. Therefore, we have S here plus S, serotonin syndrome. All migraine medication that you see them have triptan, they are serotonin stimulator receptors. So there are some medications you should avoid in the patient. This is what the question is about SSRI. So if you're taking SSRI, you should not take tramadol. Another medication is trazodone. It also stimulates serotonin. You should not take sumatriptan. You should not take linezolid. This is it's an antibiotic. You should not take it. So there's a bunch of medication that you should know. So for this question, this is gone, this is gone, this patient is fine, this. So 1, A, B, D, and E are your answer. You don't have to choose all of them. If you choose some, you get, enough, but don't choose all of them. Okay. What do you see on the board? Who need immediate intervention? Who do you think need immediate intervention? 4 people. You are in the trauma scene. The way I do trauma scene is, I know there's a bunch of stuff out there. Look for the black person, somebody who is dead, black, and eliminate it. Then find your red. Use the black to find your red. If you forget about the yellow, I don't do colors. So I'm not even going to put colors there. There's only 2 colors I pay attention to, black and red. Who is black? Black is somebody who is dead already. There's nothing you can do for them. There's too severe, you can't do anything for them. You have to master this. These are not that difficult questions. If you master it, black is somebody who is dead and he has severe injury. There's nothing you can do for them. And then red is somebody, if you have chest wound, anybody with the chest wound is red. Because chest wound means you have airway problem and a breathing problem. If you have pulse issue, yeah. So left BKA. BKA alone is red, okay? Because the patient has bled. This is the strategy. BKA is red because they have, when your above knee amputation, no, below knee amputation, that's what it means. Below knee amputation, traumatic, that means you bled. You've had hemorrhage. That one alone is good, but the patient is apneic. So there's nothing you can do. They're already dead. So it's gone. GCS of 3, they're not even moving. There's nothing. The people is all blown, nothing like that. And this is the trap, small laceration. His head is gone. Let him go. BK is below knee amputation. Below knee amputation. So is below knee amputation. Now, Client with paradoxical chest wound. I told you chest injury is always a problem. His chest is not moving. He's moving in the different direction. Right side is moving different from the left. It shows you that there's a multiple rib fracture. That's what we call flare chest. When you take a deep breath, your chest wall rises up. Okay? And when you expire, it falls down. This one is different. The movement, when they take a deep breath, the chest goes down because it's paradoxical chest movement. That side that is injured. Therefore, this patient, we got to mark him. Anybody greater than 60% total body surface burn is dead. There's no way. If you calculate how much fluid he's going to get, and this is a trauma, you don't have time for this patient. So don't worry about him. So this one is gone. This is your patient. Whoever have a severe injury that is not salvageable, you let them go. And that's how you do prioritization. You don't have to call it BESHARP. But when you do prioritization, think like, I have a second. Who do I want to give that second to? Somebody that has expected finding that you can deal with later on, or somebody you don't have time with. And that is what it's all about. Okay. Good luck in studying, and all the best of luck.